So I actually have some supplements I give patients to help them heal after surgery. You know, often when I'm doing spine surgery, I'll check a bone density test, even on young males where you expect their bone to be normal. I've recently had 2 men in their 30s with osteopenia. So a lot of it's genetic. And we need to promote good bone healing and tissue healing. So some of the things we use that I have my own supplement line, are, I call it Bone PM. It's a calcium, magnesium, zinc in combination with a really good vitamin D3. So if you take this during the time period of it, like 3 to 6 months, it really helps the bone heal, grows into the implant, or helps augment the bone recovery. Also, I use DHEA, helps raise testosterone levels slightly for men and women. This also helps promote muscle growth, muscle healing, tissue healing. There are other things I have as well. I have many different other supplements. So I'm just showing you a few because these are all valuable in your recovery.